so I'm going to do an incentive spirometry. So I'm going to do it with the volumetric exercise here machine. So first off, before anything, I'm going to check the patient's chart and always check for the doctor's orders. And then I'm going to coincide, so I'm going to check to see when their pain medication would be, and then I would coincide that with the pain medication. So then when I'm ready, then I can enter the room. So I'm going to knock on the door and introduce myself. Hi, Mr. Smith. My name is Amy, and I'm a respiratory care student with the respiratory care department. And then first thing, I would always check the ID band before I do any treatments or anything with the patient. So I check the ID band, and I wash my hands, dry my hands, and then I am going to auscultate the patient. And then I'm also going to chart the pre-vital signs, what the vital signs show, and everything like that. So when getting this ready, it always comes with a chart here. And so here's a chart. And so here we would, for like me, I'll just do me as an example. So I'm in between the 1900 to 1850. So I get my machine ready here. Try not to touch the mouthpiece on anything. And so I turn it to where I can hook it in. And then I would set it down to where it needs to be. And then I would watch if they have good inspiratory volume. And then I would like to watch this. And then there can be a machine that can be connected to it to measure like see if they are getting the proper inspiratory rate that they need to be to get their full volume. So if they are elderly patient or somebody that may have problems like post-operative patient, we can start them out at a lower volume, just that way we can give them little goals to reach each time. That way if they're in pain, you don't want to cause any more pain, so then you can just start them out at a low one and go from there. And so with these, you want to do it 6 to 10 times per hour, just depending on the patient, if they're able to do it that many times. If not, then we'll work up a goal on how many times they can do it. So as always, you want to have the patient take a breath in and exhale, and then on the next inhale, you'll inhale nice and slow, about 3 to 5 seconds, and hold. And then when this little white circle thing goes down, then they can exhale out of from the machine. So I'd inhale, and then exhale, and then inhale. So I do that, and then if they can do it again, I'll give them a break before I do anything else. I'd always give them a break, and then I would put this on the side. I can get in a bag or something to store it in, just to place it in, that way it doesn't touch anything, it doesn't get contaminated for the patient. So then at the bottom of this can be a patient's to keep, so we can put their patient name there, the room number, and the date that we give them the machine. And when you're doing this, you always want to keep it upright. And you can set the bed if they're not able to sit up to give you like their full lung capacity. Then we can raise the bed or do whatever we need to get them to do the exercise with us. And then with this, we always want to make sure we come back and check on the patient to make sure they're doing it properly. That way they're not just doing like a quick breath. We want to make sure we do it along with them to make sure they're getting the appropriate volume that they need to be at. So I just set this inside where I can set it aside to where it's not going to be in the way. And also for like the patient, I can set it next to the bedside, that way somewhere close to them, say like if they're somebody that can't get up and move, like in the hospital or anything, then I can have it set next to their bedside, somewhere where they can reach across and grab it to practice and do that volume exercise. As well as when I'm done with the any exercises, breathing treatments, I would always auscultate the patient. I would read their vital signs, see where they're at, and always get their temperature. And then I would go chart, but before I leave the room, I'd always wash my hands, make sure anything, reassemble the room if they have anything that I had moved away from their bedside, and then chart and let the nurses know.